Health Break, brought to you by CHI St. Joseph Health.
Physical therapy and injections can be very effective in treating shoulder arthritis, but in some cases a patient may need more. Dr. Kevin Magone from CHI St. Joseph London says one option is a shoulder replacement procedure.
When we do a shoulder replacement, we actually remove part of the joint and we place metal and plastic within. Part of my training is I actually do this with computer navigation, so it helps me put it in more accurately and preserving more bone for the patient's native anatomy.
There are two different types of shoulder replacement, so your surgeon can help you choose the one best fitting your arthritis and the condition of other components in your shoulder.
Because it's definitive treatment, you're taking out the arthritis and replacing that with metal and plastic that they feel more comfortable with their shoulder. Most patients return to their normal activity, whatever that is defined as for them. Going back to golf, tennis, recreational sports.
For more information, go to chistjosephhealth.org. I'm Beverly Herbert.